Hemostats. Definition, types, parts, uses, precautions, and how to use. Definition, hemostats are surgical instruments used to control bleeding by clamping blood vessels or tissues. They function as locking forceps and are commonly used in surgical, dental, and emergency procedures to achieve hemostasis, the stopping of blood flow. Types of hemostats. Hemostats vary in size, shape, and function. The most common types include 1. Curved hemostats, used to clamp vessels in deep or hard-to-reach areas. 2. Straight hemostats, used for general clamping and grasping purposes. 3. Mosquito hemostats, small-sized forceps for delicate and small blood vessels. 4. Kelly hemostats, medium-sized, partially serrated forceps used in various procedures. 5. Cryal hemostats, similar to Kelly but fully serrated along the jaws. 6. Carmalt hemostats, used for larger vessels, have longitudinal serrations for better grip. 7. Rochester hemostats, larger forceps used for clamping heavy tissues or blood vessels. Parts of a hemostat. A typical hemostat consists of the following parts. 1. Jaws, the serrated or smooth gripping surface that clamps tissues. 2. Ratchet, a locking mechanism that holds the instrument in place. 3. Shank, the long body of the instrument connecting the jaws and handles. 4. Box lock, the hinge that allows smooth opening and closing. 5. Finger rings, the loops where fingers are placed to control the instrument. Uses of hemostats. Hemostats are widely used in medical and surgical settings for clamping blood vessels to stop bleeding, holding tissues or small surgical instruments, assisting in suturing by holding needles, removing foreign objects in emergency situations, dissecting tissues in surgical procedures. Precautions when using hemostats. To ensure safe and effective use, consider the following precautions. Sterilization. Always sterilize the instrument before and after use. Proper handling. Avoid excessive force to prevent tissue damage. Selection. Use the appropriate size and type for the specific procedure. Inspection. Check for any damage or malfunction before use. Secure locking. Ensure the ratchet locks properly to maintain a firm grip. Avoid overuse. Prolonged clamping may cause tissue necrosis. How to use a hemostat. Follow these steps for proper use. 1. Hold the hemostat by inserting your thumb and ring finger into the finger rings while supporting with your index and middle fingers. 2. Position the jaws around the bleeding vessel or tissue. 3. Clamp the hemostat by engaging the ratchet to lock it in place. 4. Ensure proper pressure without crushing the tissue. 5. Release the clamp by pressing the ratchet mechanism to disengage the lock. 6. Dispose or sterilize the hemostat after use following proper medical protocols. Would you like any additional details or clarifications?